Good evening, everyone. Good afternoon, I should say. It's only afternoon time. There's always something new with this challenging virus. A lot of new developments we'll update you on today. The most important thing is people are getting protected every day. This is a race against the clock, and we need to be careful and continue to wear masks and avoid socializing, especially if you haven't been vaccinated yet. If you've been fully vaccinated, which means 2 weeks after your second dose of Pfizer or Moderna, 2 weeks after a single dose of Johnson & Johnson, you could have a lot more confidence resuming close to your normal level of activity. But for the many people who do not have immunity, the majority of Coloradans do not have immunity, the virus is prevalent. It is deadly. It's important to wear a mask and avoid social gatherings with others. Good afternoon, everyone. I'm joined by CDPHE Executive Director Jill Ryan. She'll provide an update on where we are and the county level COVID trends. Tri-County Public Health Executive Dr. John Douglas is here to discuss how important and we fully support regional coordination and how that can and should look after April 16th. When the dial system evolves into guidance and helps empower our communities to take the strongest steps they can to protect people from COVID infection. But I know what's on many of your minds, so before sharing those updates, I want to go to Colorado's Chief Medical Officer, Dr. Eric Frantz. He is here to address our state's response to the CDC and FDA's recommendation to pause distribution and administration of the safe and highly effective Johnson & Johnson or Janssen vaccine in the U.S. Following 6 adverse events in 1 million cases. And Dr. Frantz will update us on that. We'll then get into our other areas, and then he'll be available for questions as we will on the other topics. Dr. Frantz?
Thank you, Governor, and good afternoon, everybody. Yes, as you all know, this morning we heard from the CDC and the FDA that 6 cases of a very rare blood clotting condition called cerebral venous sinus thrombosis, or CVST, had occurred in the couple of weeks following J&J vaccination in the United States. And because of that, the CDC and the FDA have decided to pause for a moment on recommending any more vaccinations for J&J. They're allowing the states to decide, and our Department of Public Health and Environment, in consultation with the Governor's Office and the Vaccine Task Force, has decided to pause our own use of the J&J vaccine in our state at this time. I think this pause is a strong reflection of the national oversight of vaccine safety. Seeing events like this occur, something very rare like these 6 blood clots, really do require us to take a moment and look around. The first question really is, are these events coincidental, just happening to follow the vaccine, or are they somehow associated with vaccination? That'll be the work of the next few days, couple of days here in the United States. We know that this condition among these 6 women, CVST, occurs very rarely. We would expect that a million persons followed for a year would only see 10 to 13 cases occurring. The work we'll be doing is to understand in the United States whether the rates have been actually higher in the few weeks following the J&J vaccination. I do expect that over the next day or two, with this review occurring, other cases will be identified. Hospitals across the nation may have cases today that they'll report to the CDC as well. And that will allow us to get a better sense of the number of these events that seem to occur in the weeks following this vaccine, and our ability to determine, is this just coincidence or is this something more associated with vaccination? Tomorrow, the Advisory Committee on Immunization Practices will meet. The ACIP will review all the data that's available. I'm sure they'll look at data from other countries. They'll have specialists in immunology and hematology come to discuss these findings. And they'll review the rates that they see of this rare event and maybe other clotting factors that may follow this vaccine. From there, they'll make some decisions, and I expect by the end of the day tomorrow, we'll be hearing more about recommendations. So in the meantime, out of an abundance of caution, the state of Colorado will pause on its use of J&J vaccine. After our press conference, I'll be happy to take questions. Thank you.
And again, this pause recommended by the FDA and CDC is designed to increase public confidence in the vaccines. And we want people to know that the vaccines are safe and effective. I personally got the Moderna vaccine. I have friends who got Johnson & Johnson, friends who got Pfizer. And on a call with the White House today, it was indicated that this delay in Johnson & Johnson would be days, not weeks, is how they put it. And that is the very likely scenario. We need all three to defeat this virus. Obviously, the quantity of Moderna and Pfizer have been higher. Those quantities are continuing. We're going to have over 350,000. The quantity of Johnson & Johnson has been erratic, but we really want all three back online as quickly as possible to defeat this virus. I think this will just be a few days here while the protocols are developed to track for any statistical aberrations with regard to impact of any of them on health. So that we'll be following CDC and FDA closely on that. I think that we will have more information on that as we receive that. And the Advisory Committee on Immunization Practices, as Dr. France said, is meeting April 14th to review the cases and discuss the significance. Just to put things in perspective, this virus has killed over 550,000 Americans. I think it's more than 1 in every 600 Americans that lived at the beginning of the year have died from COVID. That's a startling figure. So while it's very important to know what the different risk parameters of relatively minor risk parameters of any vaccines are, there are none that even approach 2 or 3 orders of magnitude of the risk of the virus. So please get vaccinated. Moderna and Pfizer are currently being offered. If you had a Johnson & Johnson appointment, check with your provider. We're trying to substitute in Moderna and Pfizer. If you really want the one and done, you can reschedule, hopefully just a few days or a week later, but you probably will be. We're trying to make sure that you can keep your appointment and get Moderna or Pfizer. That won't be the case in every instance, in part because of the different storage protocols for the different vaccines, but we're doing our best to get to the providers who had J&J appointments, Moderna and Pfizer, for the people that want to keep their appointment. For the people that specifically want Johnson & Johnson, you will likely have to reschedule. So we don't expect that to be too long. All we know at this point is it's likely to be days, not weeks. We might know more after the review from the Advisory Committee on Immunization Practices. We'll be happy to answer, and Dr. France will be able to answer from a medical perspective. I can talk about from an operational perspective how that will work. But I think the important thing is if you had a J&J scheduled in the next few days, check with your provider. Many of them will be substituting Moderna or Pfizer, and you can go in and still get vaccinated on schedule. Some of them cannot, and we'll have to reschedule you, and then you can reschedule elsewhere. Or if you want J&J and not Moderna or Pfizer, you will have to then reschedule once that becomes available again. That's the summary of what it means to you. All three are very effective, and we need the more weapons in our arsenal as possible to end this deadly global pandemic, which is on the rise in Colorado. And that gets into our numbers. 1,904 new positive cases yesterday. That's out of 19,231 people tested. So we had a daily positivity rate that has spiked to 7.84%. That's the highest daily positivity rate we've had in some time. The 7-day positivity number, 5.72. Those higher positivity numbers are a function of two things. One is increased prevalence of the virus in Colorado and across the country. We're tracking pretty much with the national numbers. But the second is decreased testing. That's one that we can immediately do something about. If you are ill, experiencing flu-like symptoms, or think you were around someone who coughed at the grocery store or a family member that may have had COVID, please get tested. It's never been easier. You can get them in your home. Sent to you. You can go to any site and get tested. Go to covid19.colorado.gov. Click on testing to find out. It's widely available. That's one of the big differences. People ask, what are the differences between now and last year? You remember how hard it was last year, and there were a few drive-through sites, and people had to wait hours, and Colorado was one of the first in the country to set these up, but it was still hard just because of the quantity of testing. Now, testing is universal, still free, quick, easy, many different ways to do it. In fact, if you're a frontline worker, if you work in a job that requires you to interact with others, the state will send you free tests to your home. So you can test yourself once every 5 days. And you can get the information on signing up for that at covid19.colorado.gov too. We've already sent out hundreds of thousands to teachers across the state who are testing regularly. Please get tested. And then, of course, for those who are positive, self-isolate. And if you're experiencing flu-like symptoms with this increase in positivity, there are many more COVID cases right now. So until you know it's not COVID, just assume you do have COVID. And please don't go out or associate with others. Self-isolate, quarantine if you are sick, if you are ill, if you have fever, loss of smell. And of course, get tested. If it's not COVID, you can resume normal activity sooner. If it is, please isolate until several days after your fever and last symptoms have disappeared. What we're going to see in the modeling today, and Director Ryan will provide an update, is nothing surprising. It's that we're seeing a reverse trend based on age and hospitalizations. The amazing news is the vaccine is working as advertised. We've never seen such a small percentage of people in their 70s and 80s and 60s hospitalized. It's going down. It's wonderful. Now, the bad news is there's increasing numbers of people in their 20s, 30s, and 40s getting hospitalized. So that percentage is increasing substantially because not nearly as high a percentage of people in their 20s, 30s, and 40s have yet been fully vaccinated. It's open to everybody. If you're in your 20s, 30s, 40s, 50s, and haven't been vaccinated, please get vaccinated. We want to reverse that trend. We want to see it take that same trend line that set people in their 70s and 80s are already following. But it really is great news to be able to see in real time how there are so many fewer hospitalizations of people in their 60s, 70s, and 80s. Colorado has confirmed 1,578 cases of the B117 or UK variant, 12 cases of the P1 Brazil variant, 25 cases of the B1351 South African variant, and 516 cases of the B1427 and B1429 California variant. About half the specimens we're testing weekly are the B117 variant. That's the UK variant. Another quarter are the B1427B variant. So far, all three vaccines are effective against all variants. However, the variants are more contagious and therefore more deadly. They simply spread easier. When they spread easier, they infect more people. Even if it's a static percentage of people that need to be hospitalized and die, that number's higher because more people get them. And the B117 variant represents a significant portion of new cases. And we're closely monitoring the very easily transmissible P1 variant. And if you're to contract COVID today, it's more likely that you were exposed and have contracted a variant strain. And that is simple a model of a mathematical kind of real-time evolutionary model. The more prevalent strains, the more contagious strains crowd out the least contagious strains, right? Because they're more successful in getting their human hosts to spread them. Regardless of variants, overall we know that the long-term effects and deadly outcomes can still impact Coloradans of all ages, meaning if you are in your 20s, 30s, and 40s, even if you don't end up in the hospital right away and you get COVID, there's still a chance, and we're seeing this, that people have long-term health impacts from COVID. That's why next month, while more people are getting vaccinated, it's critical for each of us to take the actions that may seem small in our own lives, but have an outsized impact on your friends, your loved ones, your family, and the future of our state. Along with getting the vaccine as soon as you can, sign up and get it. It's crucial that Coloradans continue to take common sense safety measures. Wearing masks, trying to stay 6 feet from others, staying home if you have any symptoms and sick, getting tested if you think you were exposed or if you have any symptoms. And if you really want to socialize with others, do it outside in small groups instead of indoors in large groups. Outside, small groups, hiking, biking. We have beautiful spring weather today accepted. We have a few more days of this, but it'll be back to beautiful spring weather soon enough. If there's somebody you're longing to socialize with or hang out with, small groups, outdoor activities are terrific in spring. There is no one who is invincible in the face of this virus, but every Coloradan 16 and up can now gain highly effective immunity by getting vaccinated. And you don't just protect yourself, you protect everybody that you come in contact with by being successfully vaccinated. And while the increase in variants is a concern, our rapid and equitable vaccine distribution efforts are absolutely critical to beat this race against the clock. I'm proud that here in Colorado, 25%, a quarter of all eligible Coloradans are now fully vaccinated against COVID-19. That's over 1.2 million people, almost 1.3 million people in our state, fully immune, fully vaccinated. And we have 2.1 million Coloradans that have already gotten their first dose. They're well on their way to vaccination. Some are a week away, 2 weeks away, 3 weeks away. So we are rapidly making progress. We're building on this momentum. We're standing up dozens of vaccination clinics and equity clinics across the state. We're getting shots into arms at the 6 state-run community vaccination sites. Last one I checked this morning, there were appointments available at some of those. That's the Ball site, Dick's Sporting Goods, Pueblo, Colorado Springs, Grand Junction. And I think you can go to covid19.colorado.gov, click on vaccines. There were many slots available last time I checked. And we also have the efforts to reach out with community organizations across the state. With higher levels of community now that we have, this fourth and we hope final wave will not be as deadly as the previous waves. However, it is still a risk to you. The risk to you of getting COVID is the same as it was. The risk to society, to hospital capacity is less, but the risk to the individual is the same it has been. And that's why it's important that you take the precautions to avoid being infected and avoid infecting your loved ones. Now, in this world where more vaccines are being administered, we want to ensure that the response on the local level is nimble, reflects our progress, reflects the best way to communicate to the diverse populations that make up our state. Even with new variants, counties are in different places with regard to disease transmission, with regard to their normative judgments between balancing economic activity and disease transmission. And we're confident that with great vaccination progress, shifting the role of managing the pandemic through a statewide restriction can successfully transition to greater responsibility at the local level, and yes, greater responsibility at the individual level as well, making that correct choice to wear a mask around others and avoid socializing with people outside your household whenever possible. On March 24th, we put Dial 3.0 into effect that moved in the direction of providing greater flexibility to communities across our state. That included a number of measures around five-star businesses. Many counties will continue to pride themselves on being able to certify businesses that have COVID safety protocols in place so that consumers are more confident going there. Doesn't mean you can't get COVID there, but it means those businesses are going above and beyond. And many counties have embraced that. The dial will devolve to local control as we announced on April 16th. Now, that doesn't mean that the state in any way, shape, or form is letting up on our efforts to suppress the virus. We're continuing two very important statewide measures to protect Coloradans no matter where you live. One of those is the statewide mask mandate that goes into early May, and we've already said we will likely continue schools and other mask requirements through the end of the school year. We don't want to risk the return to in-person education, which our state has been very successful with. But we have the statewide mask mandate through May 6th. That has been inaccurately characterized, by the way, by some in the media as not a mandate. Every county in the state has some form of mask mandate. It's a little different in different areas, but for personal services and haircuts and massage and for schools and for public offices of the state, there's a statewide mask mandate. There's other areas where it applies to even more folks. But no matter where you live, the best advice is wear a mask around others. It's that simple. It's the right thing to do, especially if you haven't been fully vaccinated, right? Again, if there's no mask requirement in your area, if you've been fully vaccinated, you can, do as I do. I'm fully vaccinated. I still wear a mask to set an example. But if you really don't like masks, you're in a lower risk personal position if you've been fully vaccinated. But if you have not been fully vaccinated, it's more important than ever before to continue to wear a mask when you are around others. And we expect that many local governments will go above and beyond these state measures. And I want to thank those local elected officials and public health for stepping up to continuing to protect Coloradans, especially unvaccinated Coloradans. who are still very much at risk from this deadly virus. The state is also doubling down on outreach, and we are launching ads and multimedia communications in English and Spanish to inform the public of the ongoing risks that exist and the steps that people need to take to protect themselves. We're seeing local public health agencies doing incredible work, collaborating with neighboring counties with similar disease transmission levels to save more lives and save more livelihoods. And I'm excited for you to hear about the approach Tri-County is taking to determine the best continued response in some of our largest Colorado counties. First, before we get to Dr. Douglas, who Jill Ryan will introduce, I want to turn it over to Director Ryan to discuss the latest modeling and evolution of the dial system. The two things that are statewide that are strong are the statewide mask mandate, and the other one is indoor capacity limits for highest risk settings, right? 500 or more people. It doesn't mean they can't happen, for instance, the Nuggets, but it means they need to happen under a variance or state supervision to make sure that they have the right protocols to prevent a deadly mass spreader event. And so that is really the goal of the state, working with our local governments to help them realize their dreams and ambitions and make those very difficult normative and ethical considerations about how we can best protect people's livelihoods and people's lives. With that, I'll turn it over to Director Ryan.
Thank you, Governor Polis. Good afternoon. We're at a pivotal point in the pandemic. 1.3 million people in Colorado are now fully vaccinated, and we are so grateful to have nearly 1,300 vaccine providers in our state. But the pandemic is certainly not over yet. There are still unknowns, particularly with the many variants of concerns that our department is tracking daily. Some appear to be more contagious and potentially less effective against a vaccine, and we now estimate that more than half of all cases occurring in Colorado are due to what the CDC has termed variants of concern. We need to continue to be vigilant. We need to keep our distance, continue to wear masks, and continue to keep getting vaccinated. I want to talk a little bit about modeling. Our partners at the Colorado School of Public Health, in their latest model report to be released today, are showing that the effective reproductive number of SARS-CoV-2 statewide is just above 1. And this indicates that infections are increasing in Colorado. Currently, they estimate that 1 in 196 Coloradans are infected. The report also shows that approximately 30% of Colorado's population is currently immune from SARS-CoV-2 as of April 5th. This is both by vaccination and by prior infection. However, they're also reporting that mobility is reaching its highest level since the start of the pandemic. I think people are getting excited to move about, but we have to remember that we have not reached herd immunity yet. Their report suggests that we need to maintain transmission control at the same level for at least the next month in order to prevent a spike in hospitalizations and deaths from COVID-19. And I'll show you this slide. The School of Public Health uses current hospitalizations to be able to do modeling on several different metrics, and one is transmission control. This shows estimated transmission control, including mask wearing, social distancing, and vaccinations. And as I said, they want us to keep up this level for at least the next month. And by then, maybe Coloradans can be able to relax some of the behaviors that have been so critical in controlling the state's epidemic. Next, I want to talk about the evolution of the dial system. Currently, the state has a public health order in place that requires social distancing and other restrictions for all counties based on the local level of disease transmission and percent positivity of tests. On April 15th, we will be shifting to more local control over disease transmission. So I want to show you disease transmission by county. And counties are really at varying levels of disease transmission, and this is a constantly shifting dynamic. And the next slide will also show you what a reduction we've seen in number of deaths among Coloradans. So by vaccinating the most vulnerable first, we've brought down disease transmission significantly in older Coloradans, hospitalizations, and correspondingly the number of new deaths. 81% of people over the age of 70 have been vaccinated in Colorado. In Colorado, our North Star has always been to protect the common good of our of our hospital system, and making sure that everyone who needed a bed could get a bed and that the system was not overwhelmed. And so with more and more people becoming vaccinated, including our most vulnerable, the state is at a point where we feel like now is a good time to start devolving disease transmission control to the local level. So on April 16th, the dial will evolve from a statewide public health order to guidance. This will empower counties to do what is necessary to protect their communities. The School of Public Health report discusses the need for continued policies around mask wearing and social distancing, which is something we all agree on. We know that many counties plan to implement some form of the dial through a public health order. We want local governments to be able to be more nimble, creating local orders where necessary, especially indoors, where we know the virus is more likely to spread. And it's why we're being so clear in acknowledging the authority of counties to protect public health. And we are strongly recommending that local governments keep social distancing and mask orders in place. We believe that orders at the local level are an appropriate path, allowing us to balance the need for economic recovery and the need to slow transmission, two things that have a tremendous impact on overall public health. But in addition, the state will be providing a base layer of protection through an order that will address mass gatherings and other indoor high-risk settings. The state will also continue to push for individual behaviors that result in high levels of transmission control through key policies, such as our statewide mask order, and implementing a statewide paid multimedia communications campaign in multiple languages to deliver critical public health messages. Starting this week, the state will have public service announcements to remind Coloradans to follow public health protocols like masking, distancing, and staying home when you are sick, especially if you are not yet vaccinated. The public service announcements will be published on television, through streaming services, social media, and digital channels targeting 18 through 50-year-olds, and I want to show you an example.
As more vaccines are given, the end of this terrible pandemic is near, but we're not there yet. Our progress is threatened by a rise in hospitalizations of unvaccinated younger Coloradans and newer variants of the deadly virus that spread easier. We need to stay vigilant for just a few more weeks, especially those that aren't yet fully vaccinated. Please keep wearing a mask, keep social distancing, and stay home if you're sick. We've all sacrificed too much to let our guard down. Don't get sick now. Let's finish strong and power the comeback, Colorado.
That is our own Dr. Rachel Herlihy, who's the state epidemiologist at the Colorado Department of Public Health and Environment. And with that, I would like to introduce Dr. John Douglas. Dr. Douglas is the Executive Director of Tri-County Health Department, providing public health services for Arapahoe, Douglas, and Adams counties. He's been a tremendous partner throughout this pandemic. We've always shared the same goal: to protect Coloradans, to protect the healthcare system and hospitals, and to save lives. My department and local public health agencies will work together during this transition, but we need Coloradans to really focus on the guidance of their local public health agency, and when in doubt, follow the protocols we've all become accustomed to. Mask on, physically distance, wash your hands, and stay home when you are sick. Dr. Douglas?
Thank you very much, Director Ryan. Good afternoon. Again, I'm Dr. John Douglas, Executive Director of Tri-County Health Department, which covers Adams, Arapahoe, and Douglas counties. Now, realizing, as the Governor and Director Polis have said, that while we've made great progress over the past 3.5 months and are gratifyingly seeing our vaccination coverage get better on a daily basis, given the uncertainty of the variants, we're not quite out of the woods, we're not quite through the tunnel yet. Therefore, as the states decided to devolve control efforts to local public health agencies such as ours, we've collaborated with public health departments across the Denver metro area for the past several weeks to ease our transition back to full reopening through a short-term extension of the dial. Our collaboration is called the Metro Denver Partnership for Health. It includes Boulder, Broomfield, Jefferson, Denver counties, as well as the 3 counties that Tri-County covers. While our individual public health orders vary slightly, our core strategy is similar and is really built on 2 steps. Phase 1 is a short extension of the dial, in which each county will move to the next less restrictive level, once the state's order ends. That will be on April 16th. For most of us, this will be a 1-month extension, extending through May 15th, after which we're going to move to what we call the clear level, which means that all local restrictions will be lifted, capacities back to normal. Phase 2 is an observation period of several months in which restrictions will, from full reopening, will be reinstated only if a certain key metric is exceeded. And that key metric is one of severity. It's increasing hospital admission rates above certain levels. The rate of new admissions will be measured over a 14-day period to give us enough stability to be sure we're measuring it accurately. Now, we think this regional approach will do 3 things. First, it's going to give us an extra month to provide more of our residents with vaccinations. Secondly, we think it's a smart approach, balancing thoughtful caution with our desire to fully reopen. And third, we think it creates predictability over the next several months and consistency across a region in which our residents cross county lines regularly for work, social matters, shopping, et cetera, et cetera. And then, of course, finally, we really think this is going to be a path to get us back to where we all want to be, which is safely and fully reopened. In closing, I would echo the importance that you've already heard from all of my colleagues here of continuing to practice smart behaviors. Mask wearing, appropriate social distancing, staying home when sick, and getting tested when sick. And then finally, taking advantage of this fantastically increasing opportunity to get vaccinated. With vaccines that appear, in spite of the news we heard about the J&J vaccine today, to have a very, very highly favorable benefit to risk ratio. Thank you.
Thank you, Dr. Douglas, and I really encourage other local elected officials, public health departments to really have the same kind of thoughtful actions and a thoughtful approach that Tri-County is taking. We're not out of the woods yet, and if sticking with some requirements in your area of the dial system works for your community, local officials should opt to do what works best to continuing monitoring disease transmission and hospital capacity. The statewide concern, and what I've said a number of times, is we do not want to overwhelm our hospital system, which means we wouldn't have capacity for people with heart attacks, strokes, appendicitis, or COVID. We have navigated those waters. We have avoided overcrowding our hospitals. There's some areas in the country that have not. We have done that. And while the systemic risk is now significantly reduced, that should not be confused with the fact that your risk, if you're unvaccinated, is this exact same as it was 3 months ago and 6 months ago. The individual risk is the same. The systemic risk is lower. And that's why it's incredibly important at the individual level for people to make the right choice to protect yourself, which is what you've already been doing. And as a whole, maybe people have eased up a little bit in the last few weeks. If you haven't been vaccinated, don't, right? Go back to how you lived in January, February for just another month or until you're vaccinated. Maybe you're between your first and second vaccination, as close to 1 million Coloradans are. Get that second vaccine 2 weeks after that. Then you can go back to having a very low personal risk level, right? And we'll go over the risk level there, but obviously the vaccines are 95% effective, but they're even more effective than that in the sense that for the people who do contract it, that's that 5%, they're far less likely to have severe cases and death, far less likely, and of course 95% effective in preventing infection altogether. So we're not out of the woods yet. The next 30 days will be in a race against the variants, but a full dose of the vaccine helps get every Coloradan across the finish line. And after April 16th, if a area's regional hospital capacity is threatened, we're going to partner with that local health agency and assess what the best risk mitigation strategies are in the area to slow the spread and prevent the local breach of hospital capacity. If you haven't been vaccinated, it's more important than ever before to wear a mask and avoid socializing with others until you get vaccinated. There's plenty of openings. You can sign up at a provider near you. You can find a list at covidvaccine.org, or you can call our 800 number, 877-268-2926. That's 877-CO-VAX-CO. Call and set up an appointment now. Let's work together to reduce hospitalizations, to get our number of new cases down, to save lives. Wear a mask, keep your distance whenever possible, continue doing what has worked best from the beginning until you are fully vaccinated, so we can get more Coloradans back to work and we can lead our best lives. With that, we're all happy to take questions. All of us are available for questions.
Good afternoon, Governor Polis. It's David Clue with Denver 7. Last Thursday, in response to a few negative reactions to the J&J vaccine being given out at Dick's Sporting Goods Park, you said this was likely affecting folks suffering low blood sugar, perhaps a fear of needles. Has your opinion on that changed in light of more recent events?
No, this will be important to bring Dr. France in. This is totally different than, this is 6 to 12 days after getting vaccinated. I'll have Dr. France talk about the difference between dizziness within, right after getting the shot and this new information that we have.
Thank you, Governor. Yeah, with the J&J vaccine over the last 10 days, you can be thinking about maybe 3 broad areas that we've been thinking through. We know that all these vaccines are associated with some feelings of fever, chills, pain on the site, headache, and that lasts usually between 2 and 3 days after vaccination. And of course, those are known local reactions and systemic reactions with these vaccines. Secondly, we found just this last week that there seemed to be a number of cases in Colorado and North Carolina and other states of persons feeling dizzy, faint, lightheaded, nauseated within 5 to 15 minutes after being vaccinated. And now those seem to be all related to people who were anxious, concerned about needles, had histories of fainting with needles, feeling flushed because of the moment, their anxiety and their emotions. So all of that seemed to occur within just really minutes after the vaccination. Finally, now we have some new events, rare events that are happening 6 days to a few weeks after vaccination that may be coincidental, that may be associated with the vaccine. And further work will be done in the next 24 to 48 hours to understand whether these events of blood clots might truly be related. So 3 different themes that we've heard about vaccination in the last 10 days, and none of them really related to each other. Thanks.
Thank you.
Hey
Yeah.
everyone, this is Gabrielle. Oh, sorry.
Continue, please. Go ahead.
Sorry about that. This is Gabrielle from Fox 31. I have 2 quick questions. One is for you, Governor Polis, and the other for Dr. France. My first question is, can you talk a little bit more about how the pause on J&J vaccines will impact overall supply? And I know specifically you've been working with hard to reach communities. So now that that one-shot solution is kind of off the table for now, how does that impact that area?
Yeah, there's a lot of people that I hear from that prefer the one and done, and I think that will continue. And there's going to be some disappointment that it won't be available for a few days. If the situation lasts more than a few days, it would likely have an impact and delay Colorado's achievement of herd immunity. But if it only lasts 2, 3, 4, even 5 days, I'm confident in saying that we have the supply of Moderna and Pfizer and would then be able to resume J&J, that it will not impact the timelines. So let's just watch this to see how long this pause takes until it is cleared for usage. And that will determine whether the overall timeline is impacted. But the brief pause would not impact the overall timeline for successful achievement of herd immunity. Dr. France?
And your second question?
Gotcha. And the second question for you, Dr. France, was just looking at the CVST cases. Do we have any confirmed cases of that in Colorado, or are we investigating any of those cases here?
We do not have any confirmed cases of CVST in Colorado that I'm aware of, and the 6 cases reported this morning did not include any cases in Colorado. We are working with our healthcare system partners to understand whether these cases or similar clotting cases may be occurring in our state. Right now, any case of clotting will be reported through the Vaccine Adverse Event Reporting System, VAERS, that's done by the provider who vaccinates or cares for a patient who has this unusual, a rare clotting condition. I have asked that we work with the local care delivery systems so that not only is the federal VAERS system informed of any cases, but that the state health department is also informed of any cases.
Thank you.
Dr. France, while you're there, Steve Stager from 9 News. I apologize, you cut out briefly as I was listening to your answer to the previous question. So I do want to ask you one additional follow-up. We were made aware of a case under investigation, possibly at Centura. You had mentioned that you've asked the different associations and the different health systems within the state to report these cases to you. When did that start? How many reports have you gotten? And I do have a follow-up for the governor as well.
No, actually, this morning in our planning from this news, we recognized that reports would be going directly to the federal government, and I didn't want to be at a place where the governor might find out on a federal call about some cases that we hadn't actually told him about at the state level. So just today we've made plans and to start to engage with our health systems to be sure that they're letting us know about any cases of concern. I also would say that when this announcement comes up of this group of cases, what naturally follows is more cases. Hospitals will start saying, hey, we may have something like that here in Alabama, in Oregon. We should let the federal government know, the CDC. And so tomorrow I would expect that the number of reported cases will be higher, and there may be cases from Colorado.
Got it. And a question for the governor. You know, we've heard that it could be a matter of days before the FDA and the CDC make a decision on J&J. Should it go back online, how do you overcome the public perception issues with that vaccine after the reactions at the drive-through site and now this?
So, you know, let's put this in perspective. We have about 2.1 million Coloradans who've gotten at least one vaccine. That's roughly a third of the state. Of people of all ages. So when you have that number of people that have gotten vaccinated, you're going to have people that have every conceivable condition a week or two later and would have had every conceivable condition a week or two later without the vaccine as well. There'll be people that have cancer. There'll be people that have heart attacks and strokes. There'll be people with blood clots because we have a third of the population that's vaccinated. The key question here is there any statistical difference between the people who have been vaccinated and people who haven't been vaccinated with regard to any of these side effects? We know that one thing is sure. COVID-19 is several orders of magnitude more dangerous than the limited reporting of any of these incidences of side effects from vaccines. Nothing I know about Johnson & Johnson would deter me from getting the Johnson & Johnson vaccine tomorrow. Out of abundance of caution, we're following the FDA and CDC guidelines to hold off a few days until we develop the protocols and measurements to make sure that we can restore full public confidence in all 3 life-saving vaccines.
Governor, thank you.
Governor, hi, this is John Frank from Axios. A question for you. You continue to tout that Colorado is one of the first states to open and now one of the first states to drop its statewide public health order. Why is that so important to you?
I don't know whether we are. And we're not dropping a statewide public health order. There's absolutely going to be a operational statewide health order. We talked about two. One is the mask requirement. The other is large indoor gatherings of 500 or more people. So, I mean, John, maybe you can, maybe you want to rephrase maybe based on that?
Sure. At the press conference last week, you mentioned multiple times that Colorado was one of the first states to reopen. And I'm wondering why that's so important to you.
Yeah. I think that what's important is respecting human lives and human dignity. And part of our dignity is being able to support ourselves. It's also part of the bigger picture of public health. It's important socially and academically that kids are able to be in school. And yes, I'm proud that Colorado is among the states that has a higher percentage of kids in a safe in-person learning environment, including my own kids. Is it zero risk? No. Do the benefits outweigh the risks, in my opinion, and I believe the opinion of a majority of Coloradans? Yes. We went through extraordinary measures to avoid closing indoor dining in restaurants. In many areas of the state, we work closely with them, like in Mesa County, to be able to keep restaurants open during the peaks in a safe way. Is dining indoors at a restaurant zero risk? No. Is dining indoors if you've been vaccinated low risk? Yes. Is dining indoors if you haven't been vaccinated at a 6-foot distance low to medium risk? Yes. I believe people should be empowered to make the best decisions for them. And that's been our judgment, with the overall goal of making sure that everybody who gets sick can get the best quality life-saving care. Whether it's a heart attack, a stroke, or COVID, we want to make sure that we have the medical experts there who are able to save your life. And in many people who contract COVID, and of course the majority who are hospitalized, thanks to modern medical science, they will walk out of that hospital okay. Some won't, and that's why it's incredibly important to take every precaution, including mask wearing, and if you haven't been vaccinated, avoiding gatherings with others.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, le tengo dos preguntas. Primero, sigue el proceso de vacunación contra el COVID-19, pero aún falta mayor participación de los hispanos. ¿Qué estrategia realiza usted para que llegue la vacuna a nuestra comunidad? Y la segunda pregunta sería, ¿cree usted que dejar en manos de los gobiernos locales las restricciones y normas de salud mantendría el control de la propagación del virus? Gracias.
Quiero tener muy claro que nadie en nuestro estado necesita ser ciudadano para vacunarse. Si algún proveedor le está pidiendo ser ciudadano, por favor, repórtele en la página covaxconcerns.com. Para nosotros es muy importante vacunar a todos los coloradenses. Por eso, estamos trabajando con organizaciones sin fines de lucro que estas tienen relaciones establecidas en la comunidad para organizar clínicas. También tenemos clínicas móviles, son unos autobuses que llevamos a partes remotas de nuestro estado. Queremos ofrecer las vacunas a todas las personas en todas las partes del estado. Segundo, todavía continuaremos teniendo ciertas restricciones a nivel estatal, pero le estamos dando más control local a las comunidades para que tomen decisiones basadas en lo que sus comunidades necesitan. Es importante que las personas entiendan que aunque estamos cerca de la recta final, todavía falta, y es súper importante que continúen teniendo precauciones, incluido usando las tapabocas.
Hi, it's Jessica Seaman with the Denver Post. Do you know exactly how many vaccine appointments have been canceled because of the announcement today?
we will work, Jessica, to see if there's an estimate for you. I don't think we'll have the exact numbers because these are private providers. But here is what the state is doing. We are working with all the providers that had J&J vaccines scheduled over the next few days to see if we can get Moderna or Pfizer to them. That also involves a decision point from the customer. Some prefer J&J and will not go in for Pfizer, Moderna, and will want to reschedule later. I expect, Jessica, that some of the clinics will delay and reschedule everybody, and they're set up to do J&J, and they'll want to do that maybe a week later and say we'll simply cancel. And for others, they will have the opportunity to convert their appointment at the same location into a different vaccine that we are going to work to get to that location. We will try to get you an estimate on the number of people that affects. Did you have a follow-up question?
Yes, for Dr. France.
Oh, okay.
Can you describe how the blood clots that we're seeing with the J&J vaccine differs from the blood clots that have been reported in COVID patients?
I'm glad you asked this question because it calls out the reminder to all of us that blood clots are relatively common for people hospitalized or in the intensive care units with COVID. So certainly the biggest risk for blood clots are by getting infected with COVID. We'll learn more about these specific kinds of clots that have been seen that may be coincidental or may be related to vaccination. What's unusual is that they're occurring in the drainage system of the brain. This is a very rare kind of blood clot. It tends to occur in young adults, and so if you see a group of them, it causes one to pause and say, well, why is this group happening? Let's look a little more closer and see if it's actually related to vaccination. So we'll see that over the next 24 to 48 hours. The ACIP will look at the base rates of these kinds of events in our U.S. population, and we'll make estimates about the rates of these events happening in the weeks following vaccination and see, are they happening at the same frequency, or are they more common, more often, and do they potentially signal an association between vaccination and the events?
Hi, this question is for Governor Polis. This is Patty with the Associated Press. I wanted to know if you can explain the decision to continue the transition to local control despite another significant increase of cases. And then I have a follow-up.
Well, yeah, I think that the number of cases and hospitalizations will sadly continue to go up before it goes down. And we want that to be as short a peak as possible. And we want to get the numbers down. And the best way to do that is to get vaccinated as soon as you can. And until you're fully vaccinated, wear a mask and avoid socializing with others. We have full confidence in Tri-County Health, the communities across our great state, to help make those very difficult decisions of balancing economic, public health, and epidemiological public health with all the information that we continue to make available to them.
Mm-hmm.
Go ahead.
And then following up, do you foresee any closures for businesses, sports teams, et cetera, as we see this spike if we're going to local control?
For the large-scale sporting events remain under state supervision. There's no change. Any indoor gathering of more than 500, like the Nuggets, would require a variance working with the local county health. The state wants to, for the next month, so I want to make sure that people understand that, because there was one question earlier that said there wasn't going to be a public health order. There is very much a public health order, not just the mask one. Events of more than 500 people and large indoor events will need to go through a process to make sure that they are done in a safe way and don't become super spreader events. Doesn't mean they can't happen. Of course they can happen. Rockies, Nuggets, Avs, whatever it is, it just has to be done in the right way where you build in those social distancing protocols and have a reasonable ratio of capacity to the number of people that are there so it doesn't become a mass spreader event that creates a large setback for the state. Did that answer your question?
Yes, I'm just wondering if you foresee any business closures or office closures at a local control level.
I wouldn't be the one to ask. I mean, I don't think that's called for by the numbers that I'm seeing certainly. But if that's the steps that a community feels it needs to take because the risk is elevated, people should honor that at the local level.
Perfect, thanks.